friends. What a privilege to be here again today on this live broadcast. Our focus continues to be on breast cancer awareness. And let me take the chance to welcome all our viewers from the local communities as well as from our global community. Last week we had such an amazing time. We had people from all over the world tuning in and commenting. And last week we discussed risk factors for breast cancer. And I'm going to review a few risk factors. Now we know that there are modifiable risk factors and risk factors that are genetics. Now the importance of Get Healthy with Dr. Cooper is to educate you and empower you to prevent, reverse, or improve chronic diseases through lifestyle modifications. So I do hope you will listen, call your friends, and stay with us. So, risk factors for breast cancer. Of course, we discuss your family history. If your mother or father has a history of breast cancer, if there's a first-degree relative with breast cancer, then that will increase your risk by 30%. Now, if the lady has been on a prolonged period of estrogen stimulation, for example, early menarche, or early age for menstruation, or late age for menopause, or having the first child late. These are risk factors. The use of hormone therapy, that's also risk factors. Many years ago when a woman had hot flashes, they'd come into the office and would supplement with estrogen. Now, estrogen can be a risk factor for breast cancer. As I mentioned last week, the estrogen will stimulate the breast cancer cell, and then we'll have growth and cancer. So therefore, we want to decrease that phase. And Dr. Daly mentioned having multiple pregnancy will decrease the risk for breast cancer or lactation. Now today, you're going to meet patients who have gone through this. And you will listen to their stories, and you might see yourself in one of these patients. The idea is to empower women to take control of your health, to seek early mammogram, and therefore suppress the risk of breast cancer. Now, breast cancer is the most common cancer in women. 1 in 8 women will be diagnosed with breast cancer. In the United States, over 250,000 women are diagnosed, 250,000 yearly are diagnosed with breast cancer, and about 40,000 deaths. However, worldwide, we have 1.7 million diagnosed with breast cancer yearly and over 500,000 deaths. So if you're tuning in, this is Dr. Cooper Docker. I'm board certified in internal medicine, and I've been practicing medicine for over 26 years. I am in the Rio Grande Valley, but I have various products online, like courses that you can reach out to if you want to learn how to live a longer, happier, and healthier life. At this time, we're going to take a break. You're going to be hearing from Janie, a patient of mine who was diagnosed with breast cancer. I had a chat with her last year, and this is her story. Welcome back. Today we have been talking about breast cancer and the prevention. And today in our studio, we have a very special person, Janie Trevino. Janie, you have been diagnosed with breast cancer twice. Tell us about yourself. Tell us something about your story.
Well, first of all, I did my monthly breast examination, which I found my lump, and I immediately went to see my physician, where she ordered a mammogram, which it was done, and rapidly she called me back. My physician called me back and said that I had to keep an appointment. So I did keep my appointment, and she gave me the news that I had some lump in my breast and I needed to go through surgery. And I was just shocked, devastated with the news. I just couldn't believe this was happening to me. And The same week I get referred to my surgeon, who is a wonderful surgeon, and we had this done here locally. I had a right radical mastectomy. Everything went beautifully. I recuperated. Then I find myself having to go through chemo and radiation following my breast cancer. The side effects of the chemo were very, very severe in my body. I couldn't take it. They were so strong. I got so sick. So my doctor had to decrease the amount of medication I was receiving so that my body would be able to tolerate the chemotherapy.
Very good. You said you found the lump with your monthly breast examination.
Yes.
You know, most patients with breast cancer are the ones who usually find the lump. So what would you say about the monthly breast examination? Is that very important?
It is very important. It's the first step of prevention. It is also the first step of diagnosing it at an early stage.
Very good. Now tell me, the diagnosis of breast cancer, how did this affect your family?
My family was also very devastated, but due to very spiritual beliefs and very good family support, they were all taking turns caring for me at the hospital.
Very good. What about the effect of the chemo on your body? Would you say that was very difficult for you?
It was very scary, very difficultly. I was so weak, I just laid there for 3 days after my chemos, in bed, not wanting to eat, not wanting to continue. But due to the spiritual guidance that I have, I continue to deeper into my spiritual and pulled me through with my good family support.
Very good. So would you say your faith in God was very essential for your healing from breast cancer?
Yes, it was. It's the number one key, essentially. I pray to God. I ask God to guide me, to hold my hand every time I receive my chemo. And even though I was weak, I asked God with all my heart to please carry me when I couldn't carry my own body.
Very good.
And without this, I don't think my chemos would have been possible.
Right. You know, studies have shown that faith and meditation is essential for good health. And I think that's what you expressed, and that's why you're here today.
That's why I'm here today. After 7 years of remission, then I'm hit again with my second diagnosis of breast cancer.
And what happened this time?
This time I went out of town to get my diagnosis. It was completely different, completely different. A diagnosing, biopsy, everything went well, but it happened at MD Anderson the second time around.
So now you have bilateral mastectomy.
Yes, I have a bilateral mastectomy, and I still feel very strong as a human being.
Very good.
I'm not any less because I don't have my own breast.
Very good. So your self-esteem has not suffered?
No, my self-esteem has not suffered at all.
Very good. You're a nurse, Janie, and I know that you continue to work after your first mastectomy and your chemo, radiation, you continue to work on the second breast also. Yes. How are you doing right now?
Right now, I did return back to work. I wasn't able to pull as much or push patients, but my care never suffered, my patient care. I love my job. I love helping people. So I am blessed to even teach my patients that are suffering from cancer.
Very good.
You know,
prevention. How would you advise the public about prevention and early detection of breast cancer?
The importance of monthly breast examination is essential. And second, we need to follow up with a mammogram yearly. And if we find any abnormals, refer to your physician immediately.
Right, so there has to be a collaboration between the patient and the physician.
Yes,
right.
there has to be.
What about the risk factors? We're going to talk a little bit, maybe a minute, about risk factors. Did you have risk factors for breast cancer?
Yes, we do have risk factors for breast cancer. It is in my family.
I see. Who in the family has breast cancer?
Myself and one of my sisters have breast cancer.
So now it placed you at a higher risk.
It placed me at a very high risk for breast cancer and other cancers in my family.
Thank you so much, Jenny, for being on our show today. I know you have much more to tell us, so don't go away. We'll be right back. Well, thank you, Janie. You couldn't join us today, but that was your interview last year. And I'm sure that many of you probably can identify with Janie. Family history of breast cancer increases your risk for breast cancer. And that is why we're promoting Breast Cancer Awareness Month for you to go out and get your mammogram. Janie mentioned that she found the lump. Many times the patient or the spouse will find the lump. So ladies, do not hesitate to know your anatomy. You need to become aware of what your breasts feel like. So therefore, if you were to have a new growth, then you'll be able to identify that. Now our topic today is fighting together.
Absolutely.
Am I right?
Yes.
And I have two beautiful ladies here, San Juana and Irma.
You call me Janie.
Okay, Janie and Irma. Beautiful ladies. They're attached to me, and they agreed to come so we can be empowered. All of the ladies out there, empowered to take charge of your health. Janie was diagnosed with breast cancer a couple of years ago, and Irma maybe 12 years ago. I will speak to Janie first because Janie speaks English. Then with Irma, it has to be bilingual. All right? Espanol. Okay, Janie, tell us a little bit about yourself. When was your cancer diagnosed? How many years now?
I was diagnosed June of 2014, about 3 years ago.
3 years ago.
The,
How were you diagnosed? Did you find the lump? Was it a routine mammogram? What happened?
actually, I was doing the self-check,
Mm-hmm.
and I didn't find a lump. There's a difference with the way I was diagnosed. There was indentation in my left breast.
Thank you, Jenny. That's very important. Now remember, we said that if the lump is very small, you might not palpate that lump. But last week we gave you some signs. One was indentation of the breast, one was nipple retraction, one was discharge from the nipple, and the other was discoloration of the skin of the breast. Now Janie found her cancer because there was indentation of the breast.
The left breast.
The left breast. And then you went to your physician.
Actually, no, I made a mistake and I ignored it.
Ah, okay.
I'll be honest, I ignored it and waited another month. And again, did the exam, still couldn't feel anything, but I noticed around the indentation there was discoloration, like a bruising.
Mm-hmm.
And I couldn't find the lump, and so I decided to grab the part where the discoloring was. I had a very large mass.
Mm-hmm. Okay, ladies, now remember, do not be afraid. If you see something different on your breast, if you have pain, do not be afraid to see your physician. Remember that the incidence of breast cancer is rising. However, the death rate is declining since 1990. Declining because of early detection, improvement in breast cancer treatment. So do not hesitate to see your doctor. Okay, Jenny, so you went to the doctor after you were convinced that something was wrong, and what happened?
It was a whirlwind week. I spent 5 to 6 days in a row with my doctor referring me to the hospital. I had a mammogram, had more blood work. They needed a sonogram, obviously, because they spotted something. And after the technician who was doing my sonogram was very, very quiet. And she left for a little bit and came back with 2 doctors, an intern and 2 nurses.
Oh, wow.
I said, this is pretty serious. And so the following day after more blood work, I had to have a biopsy.
Good, so the biopsy was positive.
Absolutely.
Janie, how were you treated? Did you have lumpectomy or mastectomy, radiation and chemo? What happened?
I had a complete mastectomy with my left breast. I had chemo at Texas Oncology for about 7 months. Then I was treated with radiation for about 33 days.
Very good. When was your last treatment? You were diagnosed 2014, right?
Yes, ma'am.
When was your last treatment? Now, it's 3 years later. How are you doing?
I'm doing exceptionally well,
Mm-hmm.
and I'm very grateful that you're my doctor.
Okay.
Well, only because when you're diagnosed, you're given an envelope, and you have to go see an oncologist.
Mm-hmm.
And then the oncologist gives you an envelope, and you have to see a surgeon.
Mm-hmm.
And they don't answer any questions because, you know, the tests haven't been done yet. So I turned to Dr. Cooper because I didn't want to be an envelope. And she took very good care of me, answered all of my questions, and I was able to be strong enough to proceed forward.
Mm-hmm.
But I had great care, a great oncologist, a great radiation oncologist.
And you're doing very well.
I'm doing very well, and I encourage women not to be scared.
Right.
I was scared, of course. Don't be scared. But the worst mistake that I made was not telling my children, my family, immediately.
Right, right.
And you need support.
I think you were trying to protect them from the
I was.
stress of the cancer. But at this time, you're doing well. Are you cancer-free at this time, Janie?
I am cancer-free.
Bravo, bravo. She's cancer-free. So ladies, if you're listening and you see yourself in Janie, please see your doctor.
Mm-hmm.
Don't stay around. Don't put it off. Don't get too nervous. Please get yourself help. And that is the reason why we have October in the United States as Breast Cancer Awareness Month. I'm going to give Janie a break and I'm going to talk to Irma. Irma habla español, así que hay que hacer las preguntas en español. She speaks Spanish, so I'll have to ask the questions in Spanish and I'll do my best to translate when she speaks. Irma, bienvenido.
Gracias por la
Okay.
invitación.
Sí, sí. Irma, ¿usted fue diagnosticado de cáncer del seno cuándo?
Enero del 2006.
2006. Tanto tiempo.
Mm.
She was diagnosed January 2006. ¿Y cómo está usted ahorita? How are you doing now?
Muy bien, gracias a Dios.
She's
Muy,
doing
muy
well.
bien.
And she wants to thank the Lord. Irma, ¿cómo fue diagnosticado su cáncer? ¿Usted lo tocó algo o era su mamografía? How was your cancer diagnosed? Did you find a lump or was it your mammogram?
Siempre me tocaba esa bola
Mhm.
hacia el lado de la axila,
Mhm.
pero siempre me decían que era fibrosis.
Okay, so she had this lump for a while and she was told that it was fibrocystic disease. Okay. ¿Y luego?
Y luego pues fui al año normal de mi chequeo anual y allí fue cuando, me imagino por el color que ya estaba afuera, me detectaron que era cáncer.
So then she was seen at her annual physical. She had the breast examination. Then she had her mammogram and she was told it was cancer. Y luego, ¿qué pasó después de este
Pues me
día?
hicieron ultrasonido, biopsias y empezó todo el tratamiento.
Okay, so she had the sonogram, the biopsy, and that's where the treatment began. Irma, ¿cómo fue tratada usted? ¿Con cirugía, quimioterapia, radiación y cómo? How were you treated with surgery, radiation, or chemotherapy?
Todo. Primero
Everything.
primero quimios, 3 quimios, después cirugía, después otras 3 quimios y más quimios por semana.
All right. So she had chemo first, then she had surgery, then she had radiation, and then she had chemo for about 3 more weeks. Irma, ¿usted tenía problema con su tratamiento? ¿Estaba muy grave? ¿Tenía vómito? ¿Tenía debilidad? Did you have a lot of problems, vomiting or weakness?
De todo.
She had everything.
Todo lo que se
Ajá.
tiene uno que pasar por las
Mhm.
por las quimios,
Mhm.
pero vale la pena estar aquí.
Right. She had everything, but she had all the complication, but it was worth it because she's here ¿Cómo se siente hoy? How are you feeling today?
Muy bien.
She feels very
Muy,
well.
muy bien.
¿Usted tiene cáncer en algún parte de su cuerpo o está libre? Do you have cancer in some part of your body or are you free?
Libre.
She's
Libre de
totally
cáncer.
free. Sí, sí, sí. Mire, este diagnóstico de cáncer afectó su familia, su relación con la familia o algo?
No.
Uh,
Todo
The
perfecto.
cancer, did it affect her relationship with her family? She said no, everything was fine. Y si usted tiene que decir algo a las mujeres que están ahorita escuchando usted, ¿qué va a decirles? If you had to ¿qué va a decirles? I'm asking her if she had to tell the ladies that are watching now, what is she going to say? Diles.
Que sigan adelante. Por ellas mismas, por sus hijos, por su marido, por su familia, vale la pena estar aquí.
So you must continue for your family, for your children, for your husband. It's worth it, be here. So we need to fight together. ¿No es así? Hay que luchar juntas. ¿No es así?
Luchar. Y mucha fe.
And a lot of faith. You need to fight, but you need to have a lot of faith.
Mucha fe en Dios.
You need to have faith in God. Right.
Y
See, so she said you need to have faith in God, which is important. Studies have shown that patients who pray a lot, who meditate, who have faith, tend to live a longer and a happier life. They're healthier. So if you're listening to me and you do not have a church community or a faith community, find one. It will be beneficial to your mental health, your physical health, and your social health. At this time, I had a conference with one of our local doctors, Dr. Galindo, and he has a message for you. So let's run the tape with Dr. Galindo. Dr. Galindo, tell me a little bit about yourself.
I'm Dr. Eugenio Galindo, been in the Valley since early 1990s. Formerly came from MD Anderson in Houston, Texas. And I've been currently the medical director of the Cancer Center, Mechanical Oncology, and Doctor's Hospital Renaissance.
Very good. Doctor, you have been seeing a lot of various cancer, but I want to specifically talk to you about breast cancer. Tell me something about breast cancer. Do you have a lot of patients with breast cancer?
Yes, it happens to be that this month is a month of breast cancer awareness. And this is something highly recommended for awareness. Early diagnosis makes a big difference. We have quite indeed a huge practice in breast, close to 1,000 patients right now in active therapy here with us. And breast cancer, as everybody knows, is 1 in 8 women, 12%. But, something that needs to be emphasized that if you have one family member, that risk might increase in 20%. Or you have 2 members, that risk might be 30%. So you have 2 family relatives, like a mother or a sister with breast cancer, there's a 30% chance that you might develop breast cancer. You're considered high risk. The importance of this month of awareness is to do an early diagnosis, because early diagnosis can make the difference in reference to survival. The earlier you get a diagnosis of breast cancer or pre-cancer, then the higher percentage probability of survival.
So the idea is early detection, right?
Yes, early detection is the front line of therapy. So through the American College of Oncology, we still recommend early mammograms, age 40. Through other academies, the recommendation changes to age 45 to 55 once a year, 55 to 75 every 2 years. But we're still in the phase of once a year, starting age 40. That's my personal recommendation, highly advisable. Breast cancer can be seen at any ages. I've seen patients 90 years old, age 19. I've seen patient breast cancer during their pregnancy. I've seen breast cancer patient age 90 plus. So breast cancer is seen in all women. Right. And it's important to define if there's inherited condition for breast cancer.
How can that be defined if it's inherited?
Well, it's about 10%, 10 to 15% of breast cancer is inherited. And at the present time, everybody knows about the BRCA testing, the BRCA1, BRCA2, breast cancer 1, breast cancer 2. But that's not the only gene now found. We have multiple other genes that has been identified that can determine the patient has a high risk for breast cancer, which includes, there are several, POLB2s, ATMs, CHEK2s. So there's a lot of other genetic testings that now we are aware that patient can have a high risk of breast cancer, and there's treatment plans or suggestion plans or follow-up plans that can be highly recommended to minimize the risk of the cancer to be seen in that patient.
Very good. Now, doctor, there are different types of breast cancer, and since you're an oncologist, can you briefly tell us about the various types and maybe the treatment option for these types?
So breast cancer is pretty much the two most common is the ductal. The origin is within the duct of the breast, or the lobule, which is the glands who secrete the lobules gland areas. So there's pretty much the two main components. So we have a precancerous condition, which we call in situ. So that means that the tumor is contained within the lumen, within the room, within the space, and there is no erosion of that wall. So the likelihood of that tumor to spread is less than zero. So it's pretty much nothing because it's contained. Now we have the invasive component. The invasive component is the one that tends to roll through the wall and has the potential to migrate to other areas, invade other areas, especially the lymph nodes. Breast cancer right now, throughout the process, is pretty much 250 diagnoses per year, 250,000. There's about a mortality rate, about 40,000 patients die per year for breast cancer. But we have shown that over the last few years, breast cancer mortality has decreased because new diagnosis, because new treatments. So for treatments, now we're doing less. So that means we're doing less surgery. We're doing a much better cosmetic outcome. We're doing less radiation therapy, and we're doing also less chemotherapy. In fact, some patients are not requiring chemotherapy if indeed you have an early diagnosis with good genomic behavior. The tumor behaves better, has a low risk, no chemo is recommended. So there's structures in which now patients are minimally treated and have the best outcome or better outcome. So this issue in the past, I need to have the whole breast removed, is totally obsolete. The idea I need to remove the whole lymph nodes is totally obsolete. So there is now again new emphasis, new therapies, new modalities that I can provide to the patients. The advice to all the patients is always seek adequate medical care that deals with breast cancer on a regular basis, because then you have a good foundation for the best outcome of your treatment planning and your care.
Right. You said 250,000 diagnoses per year, but that is United States numbers. Am I right?
Correct. That's only in the United States. It's more than 1 million worldwide. And here is the most common in women. Breast cancer is not the most common mortality, but it's the most common diagnosis for cancer.
Very good. Very good. Thank you, doctor. Now, there are many patients, once they hear the word cancer, they become very, very depressed and paranoid or anxious or fearful that this is a death signal. But as you mentioned, the death rate for breast cancer has been decreasing because of various modality of treatment. Am I right?
Correct. So the concept has changed. In fact, a lot or several oncology cancer diagnoses have changed. Some of them have become chronic illness. We can define that if you do an early diagnosis of breast cancer and define that they have a low risk to genomic testings, because now we have the opportunity to do more advanced testing that can determine the severity of the tumor. If indeed it has a low risk, by just managing by surgery, breast conservation procedure, managed by radiation therapy and hormonal therapy will be more than enough, and expectations might be survival rates up to 99% in the majority of the patients. So again, there's a lot of more testing, that can be given to the patient, that can provide to the physician, which will be the optimal management of the patient. So being fear is not anymore an option. Being fear is when you forget or do not follow your regular screening. When you leave a tumor grow there, that's when you have a fear. So that's what you need to prevent. This is why we have to bring this month of awareness for this type of cancer. That early detection makes a whole difference in the life of that patient and including the family that surrounds that patient.
Good, good. So there's some risk factors you mentioned, family history, genetics, but there are other modifiable risk factors. What would you tell our ladies that are listening? How can we fight? How can we prevent? How can we protect ourselves against breast cancer?
So just a little, the common inherited condition is only a 10 to 15%. And we need to verify, we need to strengthen that concept that if we do genetic testing, so you're negative, that doesn't mean you don't have the risk. Mm-hmm. You still have the risk. Mm-hmm. And then there's the other component, which is familial. So there's not genetic, but familial. You have a higher risk to develop breast cancer than 1 in 8, 12%. Mm-hmm. And then we have the environmental. So that means environmental are risk factors. You have an early menstruation at age 12, 11. You have a late menopause, age 55. What was your age when the pregnancy? After 30 years old, were you breastfeeding or not breastfeeding? Are you overweight in postmenopausal patients? Is there issues of alcohol intake? Mm-hmm. There's several factors. Do you have babies at all? Newly rapid, that's also a concept. So there are several risk factors. But prevention is pretty much what I tell my patients. First, routine screening, which you can do an early diagnosis, will be prevention. Problem number 2 will be as well healthy eating, prevent obesity, minimize the exposure to alcohol, smoking, and just be very healthy. This is the way we can prevent. There's some discussion, there's some pros and cons in reference to maybe a role of baby aspirin to prevent breast cancer. There's also some discussion, maybe vitamin D3 to prevent breast cancer. Mm-hmm. So there's alternative therapies that might be opening the doors for prevention. But again, this is in some studies are positive, some are negative, but this is the way which I usually tell my patients, be proactive, do your screening, do your testing on a regular basis. Don't be afraid, because early diagnosis will make a trick. And then help yourself, because in all this healthy behavior, will help minimize the risk of cancer.
Thank you so much, doctor. Is there any last message you want to give to the ladies? And I thank you for wearing pink.
Well, the most important thing through your program, which is an excellent program, Dr. Cooper, I would like to congratulate you, but also reach the public. And hopefully through this program, you're going to be able to help somebody find an early diagnosis and get cured for cancer.
That's it. And that's how we fight it together. Thank you so much, Dr. Galindo. May the Lord bless you. Thank you.
Bless you too.
Thank you. Thank you, Dr. Galindo. That information was vital. But I want to explain a little bit more about prevention. Now, my show is focused on helping you prevent the disease. Prevention is better than cure. How can you actually prevent breast cancer? Let's go over the modifiable risk. 1 is to reduce your weight. Try to attain a healthy weight. We discussed last week that fat tissue will produce estrogen, especially in the menopausal women. Estrogen then feeds the cells and create breast cancer. So daily physical exercise is very important. Exercising 3.5 hours a week, brisk walking or moderate exercise will decrease your risk for breast cancer. Exercise will increase blood flow. Nutrients will get to your cells. The cells will breathe and live longer. The other thing is a healthy diet. A diet high in fruits and vegetables will provide antioxidants. Antioxidants will suppress free radicals, keep your cells healthy, and prevent various types of cancer. Macronutrients and various phytochemicals and vitamins from these fruits and vegetables will improve or prevent cancer. You know, a study was done, the Cancer Prevention 1 study, that showed that people who ingested fruits and vegetables, whole grains, reduced their risk for colon cancer. Now let us extrapolate that to breast cancer. Alcohol. As I mentioned last week, consuming 3 or more alcoholic beverages a week will increase your risk by 15% for breast cancer. And if you're drinking daily, your risk will increase an additional 7 to 10%. Now you may ask, what is a drink? Now 12 ounces of beer, that is a drink. 5 ounces of wine, that's a drink. And 1.5 ounce of hard liquor, that's a drink. Avoid that. Also, decrease smoking or stop smoking. Smoking will increase your risk for various cancers, bladder cancer, mouth cancer, and breast cancer. So ladies, if you're listening to me, then write these risks down. Decrease your weight, stop drinking, eat a plant-based diet, regular physical exercise, do not smoke, and manage your stress. And that is the equation for prevention of many diseases, including breast cancer. Now, if you cannot prevent cancer, breast cancer, you have a family history, and you're just high risk, then remember, early detection will improve your risk or your chances of having a happier and healthier life. Because when the disease is diagnosed early, then the treatment will be more efficient. So ladies, do not hesitate to go out there and get your screening done. Now let me go back to Janie. Janie, do you have a family history of breast cancer?
No, not at all.
No one in the family?
No one.
Okay. Irma, ¿usted tiene alguien en la familia con cáncer de mama, del seno?
Después de mí, sí.
¿Quién tiene cáncer de
Hermana
seno?
de mi mamá.
Okay, so I asked her if she has a family history of breast cancer, and she said yes. Her mother's sister has a history of breast cancer. So remember that we mentioned family history. So if you're positive for the BRCA1 gene or BRCA2 genes, then your risk is high. Or if you have a first-degree family, mother or sister and aunt, father or brother with breast cancer, then you have a higher risk. Now we're focusing mostly on women, but as we mentioned last week, breast cancer is seen also in men. Yearly, 250 men will be diagnosed with breast cancer, and then of course, 50 will die of breast cancer, and that is the numbers here in the United States. That's not worldwide. So many, if you're listening to me, know your body. If you find a lump in your breast, then go to your doctor. Now, Irma, ¿cómo está usted protegiendo su cuerpo de no tener más cáncer? How are you protecting yourself for not having cancer? ¿Está comiendo bien?
Comiendo bien,
Mm-hmm.
asistiendo a las consultas del médico
She's
para
eating
estar al
well.
corriente.
She's going to see your doctor just to make sure she's keeping updated. Mm-hmm. Y está haciendo su mamografía
Año con
cada
año,
and
sí.
she's doing her mammogram every year. Mm-hmm. Y el estrés, usted se ve muy calmadita.
Sí, así soy.
Feliz. ¿Cómo
Así.
anda con el estrés?
No, eso no hay en mí.
Okay. So I told her that she looks quiet and happy. How is she doing with stress? And she said she's not stressed. Because stress can produce negative hormones that will just fight your body and suppress your immune system. For you to fight cancer, you need to have a strong immune system. So stress must be maintained or must be addressed. And you, Janie, how are you doing?
I'm doing great.
How about your stress level?
My stress level has gone down a lot.
Mm-hmm.
Faith has replaced fear.
Good. I love that. Faith has replaced fear.
Yes.
Did you hear that, ladies? Faith is important. I did mention that people who are faithful, who have a faith community, tend to be healthier. I remember when we met, Janie, you were so stressed, and oh boy, we had a hard time. You have changed, you have become mellow, and I love that. Am I right?
Yes.
Good, good.
I was a difficult patient.
No, you were not a difficult patient. You've never been and you're not. But just having a diagnosis of breast cancer put fear in your mind.
Right.
You know, years ago, the C word, the cancer word, meant death. Let's call the pastor, or let's call the priest. But today, as we mentioned earlier on, that's no longer so, at least with breast cancer. With 250,000 patients diagnosed a year and only 40,000 deaths, then we know that there is improvement in the treatment for cancer and patients are living longer. I mentioned last week that I have patients that are 20, 30, 40 years post-cancer and they're doing very well. So ladies, protect yourself. Prevent cancer first of all, and early detection will promote a happy and a healthier life. So don't hesitate to see your doctor. Jenny, is there anything you want to tell the audience?
Actually, I do. You have to be your own advocate for your health care. At the time that I was diagnosed, I didn't have any health insurance. And for women 50 years and older, there is help out there for women like us. And if you are deterred from going to go get help because of your lack of funds or lack of insurance, there are programs out there, but you have to be your own advocate for your own health. You have to be heard.
Yeah, you have to take care of yourself. And in the United States, during the month of October, since it's Breast Cancer Awareness Month, there are many hospitals and facilities that will perform the mammogram at a discounted rate, $99, $60. So my patients who have no insurance, then we usually assist them during the month of October by finding them locations in which they can obtain the mammogram for a discounted rate. Ladies, you don't have any excuses.
No, I don't.
Get yourself checked and stay healthy. Now, remember I mentioned that healthy eating is very important. And therefore, in our next segment, I'm going to be presenting to you a very healthy dish. It's filled with vegetables, different colors, because different colors will bring different vitamins and different nutrients, and all of these are important for good health. Let's watch the cooking segment. Welcome to Get Healthy with Dr. Cooper, a program designed to educate you on healthy lifestyle for you to improve your health, prevent diseases, or reverse diseases. Today, as you look at my table, I have 2 trays of very colorful vegetables. You can see I have squash, different color squash. I have broccoli and cauliflower and other vegetables here. Now, when you choose your plate should be colorful because different colors bring in different nutrients, vitamins, and minerals. This is a very easy dish. It's all in one plate. You'll have your vegetables and your protein in the same plate. Now, if you don't like these vegetables, feel free to choose whatever vegetable you and your family like. We're just going to toss them together like this. Toss them all together. I'm using here 1 medium-sized squash, another medium-sized squash, yellow squash, and I'm using some broccoli, and of course potato. This potato has complex carbohydrate, so your sugar should not be elevated if you are diabetic. And I'm going to be using some cauliflower. Cauliflower and broccoli, they're high in antioxidant and good to prevent cancer and heart disease. Now for the protein, I'm going to be using some tofu. And I'm using hard tofu that you just cut in cubes. Now to that, I'm going to be adding 2 tablespoonfuls of good oil. This is grapeseed oil, high in omega-3. I'm using 2 tablespoonfuls. And then I have some onions here. Let's put our onions. So we're going to put our onions already cut. And then to that, you can add whatever spice you want to add. Now for the salt, you're going to add 2 tablespoonfuls of soy sauce. We're going to get that in there, 2 tablespoonfuls. Now for the spices, feel free to add whatever spice you like. So if you like Italian seasoning, add some Italian seasoned spices there. So we're going to add some of this. Now for me, I like garlic and I like onion. So I'm going to put my garlic and onion there. So we're just going to put maybe a teaspoonful of each. Okay. And then I also like Mrs. Dash. It's non-salty. So we're going to add some of this. And any other spice you like, you can add that. Then you're going to toss this all together. Get everything mixed properly. And then you are going to pour that in a tray or in a dish, Pyrex dish. All right, so we're going to pour this out here. And make sure everything is properly stirred together so we can have the spice all over. Nicely done. All right, you can continue to stir. Make sure it's evenly distributed. And then you're going to bake this at 350 for an hour. Now I have some already prepared for you. So let's look at the finished product. Very delicious, multicolored, different vegetables bring different minerals. For more recipe, don't hesitate to go to gethealthwithdrcooper.com or cooperwellnesscenter.tv and visit us on Facebook. I'll see you next time, same station. And for you viewers who might have questions about using soy product, because soy products have phytoestrogen, and it is believed, as my patient Irma was just suggesting, that her doctor told her not to consume anything with soya. Now remember that phytochemicals, phytonutrients are different from animal products. However, if you have a controversy consuming soy products, then leave that out because there's so many other things you can consume. So don't hesitate to find my recipes in my books. I have 3 books on the market. One is 14 Days to Amazing Health, and you will find amazing health getting that book, reading the book, and practicing information. In the 14 Days to Amazing Health, I have general health information. I have a lot of testimonial stories about my patients who have used my program and have changed lifestyles. Some have gotten off medications and are doing well. That same book has over 100 plant-based recipes, very delicious, that you can enjoy. The same book has a whole section for exercise. Level 1 for those beginners, intermediate levels, and then for level 3. So if you're looking for a doctor who will be your personal coach, then buy the book. You'll find the doctor there. Then the other book is Get Healthy for Life. In that book, I laid out 9 secret principles for health. Find the book and read it. And then the other book is Incredibly Delicious Vegan. There again, I have meal plans, I have shopping lists and information on how to stick to a plant-based diet. So I have it all. Just find me on my website, www.drdonacooper.com. Janie, is there anything else you'd like to tell the ladies out there? How do you maintain your sanity? How do you meditate? Because meditation and a good emotional health is important for maintaining good physical health. How do you stay calm, Janie?
Through prayer,
Mm-hmm.
Dr. Cooper, through prayer and through quiet meditation.
Mm-hmm.
It's amazing how you can just sit in quiet and peace and not have a care in the world. Just
Very good.
meditate.
Very good.
And you suggested a prayer group. You suggested that I needed.
Thank you.
That was the only thing that I needed, and I've answered. I
Yeah.
believed I did
Because-
it, and it helped.
Wonderful.
It helped, and it's.
Yeah.
I've changed a lot.
Good, good.
I'm very calm. I don't let things bother me. I don't let other people reactions or actions affect me.
That's good. That's good.
So, I'm taking care of myself.
That sounds good, Janie. You know, as physicians or healthcare providers, we need to recognize when our patients need physical treatment, emotional treatment, or spiritual health care. And I do that a lot. My approach is a holistic approach to health. You are not a one-dimensional person. And health can only be maintained when we address physical, emotional, mental, and social. For you, Janie, you needed just the spiritual part, and you do wonderful. I'm happy for you.
Yes.
Y para la señora Irma, Irma está bien. For Irma, she's doing well. She has a very good family bonding. I just met her daughter outside, beautiful young lady. Su hija está ahí, preciosa. Así que yo sé que usted tiene una familia que está muy unida.
Así es.
Y entonces eso va a ayudarle con su salud. I'm just telling her that I met her daughter outside. She has a very strong family unit, and that has helped her to maintain good health. So listeners, remember, you cannot fight this by yourself.
No.
Together, we can be stronger. So bond with your families. Bond with your church. If you don't have a church, find one. Go online. Find a church. Bond with communities. Helping others socially will improve your health. You know, studies have shown that patients or people who have a very strong family bond or social connectiveness will outlive someone who doesn't have that strong bond by 10 years. Hey, if you want to live a happy and longer life, then help someone, bond with someone. Take the time to give of yourself to somebody else, and you will see the difference in your life. ¿Qué dice usted? ¿Qué piensa acerca de ayudando a la gente que tiene necesidades?
Hay que ayudar a la comunidad,
Ujú.
apoyarla, que haya más ayudas del gobierno para las mujeres que en realidad no tienen para checarse
Ujú.
y lo dejan para después,
Ujú.
y es cuando ya vienen más los problemas.
Right. She's saying that we need to help the community. The government needs to have more help so that the ladies that are in need can access this help and therefore maintain a longer and healthier life. ¿Qué más quiere decir a la gente que está ahí?
Que es hermosa la vida,
Life is beautiful, ladies. So,
es hermosa y seguir luchando por muy oscuro que esté el panorama, seguir adelante.
life is beautiful, and even though things might look dark, just keep going. I want to take the time to recognize some of our viewers. We have Michael Fletcher from Jamaica. I see my sister-in-law Lilith Dockery from Jamaica. I'm seeing people in the local community, Sonia, Perla, Wentia, all of you. Clarissa Casares, I know you've been following us. Share this information with others. The important thing is to touch lives in a very positive way. And can you imagine that if you're listening to this program and you were to be diagnosed with an early lesion in the breast, your chances of survival, as Dr. Galindo said, was 99%. So our goal here is to help you live a longer and happier life. And before we close the show, I'd like to talk a little bit about what God wants for you. Our Heavenly Father, He is the Creator. He is the healer. He knows our bodies very well. And He wants us to submit to Him. If we follow His precepts, and if we live according to what He wants us to do for our lives, then we'll be happier. In 3 John 1, verse 2, He said, "Beloved, I wish above all things that you may prosper and be in health, even as your soul prospereth." So remember, what God wants for you is not sickness, it's not sadness, it's not cancer, but He wants you to have life. He wants you to have good health. So follow His leading and you will have good health. And before we close, I'd like you to join us next week. Share this video with others because you could be saving a life or 2 lives. Share with your friends. Return next week. Bring your notebook. Make documentation and practice. And next week or the week after, I'm looking here for questions. I have not seen any questions, so there's no question to answer. But I'm going to review shortly that it is recommended that the breast cancer screening, the mammogram, begin at about age 40. I mean, we had a question last week. Someone wanted to know at what time do we begin the screening, and that is at age 40. So if you're about age 40, go into your doctor. If you're below 40, as I mentioned last week, that we're now seeing very aggressive breast cancer in younger women. I had a patient age 32. She found the lump. We acted with a lot of speed, but we couldn't save her. It was late. It was just aggressive. So if you're young and you find any lumps, any discoloration or indentation like Janie here, then you should seek medical advice. Ladies, you can prevent cancer through lifestyle modification. And together with your doctor and your healthcare team, we can fight together. Am I right, ladies?
Yes, doctor.
Podemos pelear juntos contra este cáncer. Es seguirla, ¿no es así?
Así es,
All
seguir
right.
luchando.
Eso, vamos a seguir luchando. We're going to continue fighting. So next week, we're going to be again on breast cancer. Next week, I might bring a chaplain so we can address stress and spiritual health. And I'm also going to bring on a lifestyle doctor, whether by interview or live, so we can discuss ways that you can prevent. Prevention is the key. However, early detection is the next best thing. Until then, I'll see you at the corner of amazing health and longevity. Ladies, thank you for joining me. Together we will fight.
Fight.
Thank you. Until next week.
Thank you, Dr. Gifford.
Thank you.